Wait, a physician who does medical record optimization still not feeling like he can get everything done how he wants? Who still feels the pull of responsibilities from various roles and wants to do right by his core priorities? Who wants to feel like he is really moving things forward on his big professional goals and yet have enough time in the day to be present at home too? If you hear part of your own story and how I have tried and failed and tried again, and you want insight to help you focus on your big professional priorities, please stay tuned for the rest of today's episode. Welcome to the MedEdWell Podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stegink, a practicing general pediatrician and online entrepreneur. Thank you so much for coming back and joining me here on this, the second episode of the MedEdWell Podcast. If you find this valuable, please subscribe, leave a review, and share with another physician or student today. Today we will talk primarily about wellness from a professional perspective, examining deep work, adding value, prioritization, and how to get out of meetings. Well, maybe not all of them, but at least you'll be able to consider for yourself how meetings may fit into your larger goals and priorities, and potentially negotiate your involvement or realign expectations. Buckle up as we dive into the show and help you take your next step in your wellness today. Before we dive in, though, let's hear from today's sponsor, TextExpander. TextExpander. Recall your best words, instantly, repeatedly. Expand information by typing a short abbreviation, and customize as you go with fill-in-the-blank style fields for names and more. Your snippets are available on all your devices, Windows, Mac, and iOS. You can try it for free today, and then click the link in the show notes to get 20% off your first year of TextExpander for an individual. And now back to today's show. Back in the first episode, I talked about my story, my first clinical position out of residency, and my path to and through burnout. Though I say through burnout, the pursuit of wellness is an ongoing journey, as though burnout is just nipping at my heels, lying in wait. I mentioned a few things that helped me return to a better place with my wellness. Those things included leaning into my core priorities, having enough margin in my life to be present at home, but also finding meaning in my work and having some different opportunities to serve others and to add value. Some of these are in my clinical role and also with the medical record optimization. But before I get into the specifics of my story, I want to share some insights from a book I read and how they apply to concentration and adding value. Cal Newport is a computer science professor who wrote a book entitled Deep Work. In it, he describes changes in what is valued in the workplace of the future, including mastery of hard things and high-level production, both quality and speed. This production is often dependent on deep work, involving concentrated effort over a period of time, requiring intense focus. He describes the mastery of a cognitively demanding task as requiring deliberate practice, with attention focused on a specific skill or idea, and then receiving feedback on your approach to hone in on what you need to learn and be productive. Essentially, this is learning and then adding value. Sounds a lot like medical training. And yet, Newport observes, quote, busyness as proxy for productivity. Certainly sounds like medicine with some of the process measures or checkboxes that live in our templates or quality measures. Those clicks or keystrokes may satisfy an external entity, but the action itself may also have limited clinical relevance. No value added, as you note, quote, counseling provided, for any number of metrics as a completing action. Potentially even just providing a handout. How did checking that box, or bringing in that drop-down list and selecting an option, help you in providing that counseling? Deep work in medicine could certainly include scholarship, grant writing, publications, quality improvement project design, but I believe that the quality, mastery, and craftsmanship that Newport speaks of could be applied to medicine in different ways. I think it could be more broadly conceptualized in the value you add to your patient's life when you use motivational interviewing for the third visit you're seeing them that they finally decide to try to quit smoking. The art of interviewing compassionately and with cultural sensitivity, effectively using the interpreter that may be in person and may only be available via phone or video. Building that rapport that allows your patient to finally open up about their mental health struggles and choose to see a therapist. The procedure that you can not only do proficiently, but you explain it in a way that the patient really understands so they know what's happening to their own body and really trusts you. These skills are part of the value that is added by physicians and others in medicine, cutting through the noise of the clinical workday to find what matters. It may not take a long time, but it takes intentionality. I, like many of you, went into medicine to be able to help people, to serve. And yet my focus is so easily distracted by what I am told is truly important. Check this box, review that, sign this form, attend this meeting. Some of these things are verbally emphasized, some are indirectly encouraged, and yet some of these things are the shallow, not deep work. Many of these tasks may be needed at some level. However, if I promptly keep up with all my emails, paperwork, and everything that everyone wants from me, I have less time to read about that new treatment my patient might benefit from. Less time to call that community organization and hear about their upcoming event that would help my patients with some of their social determinants of health. Less time to arrange and hold another case conference with a patient's school or extended family. I have to stop and ask myself sometimes, are these additional things passions of mine that I can say, absolutely, I want to be a part of this? Some things are requirements that I don't get to change, my licensure, forms I have to submit, but others are things that someone may just ask me about because I either have those skills, have participated in the past, or perhaps I just thought you might be interested. One of my core priorities and values is service, and even in college, I saw needs and wanted to help. I signed up one semester to be a lab teaching assistant for not one, but 2 physics lab sessions. The amount of time prepping, facilitating, and then grading the submissions on top of my own coursework and extracurriculars, the next semester, I decided one session was plenty for me. While I saw it in college, the desire to say yes and please others has not gone away. Again, I like helping people. I like being a man of my word and following through, but sometimes that means learning what to politely decline up front. Fast forward to being an attending, I jumped into 1.0 FTE attending life, only to find out after a few short months that I'm burned out. In episode 1, I talked about how I managed to decrease my time and then partially replaced it with an electronic medical record optimization role in my system. Okay, great. But then I had this extra role, worked as part of 3 different clinical teams across 2 different clinics, and with the meeting that I chaired and all the other meetings of each team, I had requests for up to 8 meetings a month. Still working 3.5 days of clinic, having my half day of EMR work, a half day of admin time, and then being off Friday afternoon. How was I supposed to attend 8 meetings a month? Even with the COVID-19 pandemic moving all of them virtual, most of them permanently, this was still too much. I had previously tried to jump on the call for 5 or 6 of them, but now I regularly go to 3. Consolidating my time at one clinic has helped some, but even then, I've realized that there are still lots of meetings. I can't do it all. I'm a human with limits. Value may be created as consensus is built with your colleagues around a new initiative, or any number of other benefits. But many of the outcomes of a meeting end up being information transfer. Yes, it can allow for discussion that may not happen otherwise, but for some of the meetings, I just have to be okay with saying, I'm unavailable at that time. I have fill in the blank. It could be my medical record optimization time, my scheduled time off, or that I'm in clinic. And the key to why this has worked is that I try to be engaged otherwise. Some of these meetings are more peripheral to my role, and others are central to me being a part of whichever team. But in briefly reading the minutes, if there are things that I need to follow up about, I try to do that. Whether it's sending an email, trying to find them in lunch at clinic, or even just calling them, I see that as part of closing the loop in communication, and it keeps me from getting overwhelmed with meetings. By keeping some of that margin, I'm able to get my patients seen and cared for, complete my notes, and try to manage that boundary in my wellness journey. By knowing your priorities and high-level goals, you can then figure out what tasks support these goals and how you need to take steps in moving them forward. Meetings that help you move forward on those priorities, some of which may be more of a system or company goal, those kind of meetings may be worth prioritizing more. Also, if you have some influence or leadership over the meetings, you may be able to change the structure or streamline them to allow for more value creation by the participants. In my case, I lead an interdisciplinary committee for electronic medical record workflow in the ambulatory setting at my institution. It met in person monthly prior to March 2020, drawing together a really cool mix of people from different roles and disciplines: nursing, medical assistants, quality, risk, the EMR build team, and other physicians. So it used to meet in person for 2 hours, once a month, but with the pandemic, we moved virtual. And while there was certainly a loss in terms of discussion quality, as would be expected, and the natural networking and additional questions that we would pose to one another afterwards, that was decreased as well. But overall, the virtual formats worked really well. There has still been adequate discussion, and the ability to share one screen has allowed for demonstration of new functionality and proposals. Already clued into some of these productivity principles, I looked at our typical agendas and when we finished. While we sometimes finished right at 2 hours, typically we finished around 60 to 90 minutes in. And so I decided to shorten the meeting to 90 minutes. Could it be 60 minutes if it really needed to be? Probably yes, but it's a step towards more action, more implementation, by forcing some more constraints on our discussion. Newport also talks about fixed schedule productivity in deep work, and I'll talk more about this concept in the next episode. Sure, there are the day-to-day activities that add value and are part of the craftsmanship and art of medicine, integrating your priorities and the activities that support them. But I want to take a moment to have you think, what could some deep work allow you to accomplish? Maybe it's helping synthesize an anatomy class study guide in a way that benefits you and your fellow med students. It could be writing up that case you saw in the wards last month and submitting it for publication or a conference. Maybe it's designing a quality improvement project or taking some time to crunch the numbers and see what conclusions you can draw from it. For me, an example where deep work ultimately yielded a valuable outcome was in my medical record optimization role. I had just finished my training on building things in my system's EMR, and I was ready. I had a list of things I wanted to do, and I was ready to tinker. So as an aside, in undergrad, I did a summer research internship looking at MRI characteristics of cadaver coronary arteries. The professor asked, "Have you worked with this one program?" I said yes. I'd used it in my physics classes the previous year, not realizing that my experience was limited compared to others who may have attended a large state school and had more extensive experience. As a result, when the professor obtained some code for processing the MRI results, I first had to figure out how to use it, and then set the appropriate filters to output the images how I wanted them. It took, I think, into the second week or so to even get the first images to come out for processing. So I was introduced to deep work and hard concentration on a singular problem to then move the project forward. Now, with that perspective on my prior experience and the tenacity it built, let's rejoin my story on the medical record build. It was a time when my wife was working and pre-kid that I could have multiple hours to devote to a project like this. Since that time, I've set better boundaries with some of these creative projects, thanks in large part to my wife's loving feedback and the fact that I only have 3 hours per week of protected time for a couple of regular meetings and the opportunities to offer input and build things. But at the beginning, I was able to spend the time to really dig in and experiment, learning about the different properties. Ultimately, I found a way to reference the date that a particular group of diagnoses had been used at the encounter level within a look-back period of the last year. The group of diagnoses was for the last wellness visit, which is particularly important for billing in primary care. Stringing those different things together, I was able to get it to work after a couple afternoons of deep work. I didn't know why certain properties behaved the way they did, and I had to talk to a couple technical analysts to review it and help move it through to the live medical record. But now, I and all my colleagues and staff get to make use of it on a daily basis in chart review and note templates. Deep work applied. This is the type of thing that can happen. Does it need to be a week or day or full afternoon to work? No, not necessarily. But having concentrated, focused time, even if it's 20 to 30 minutes at a time, multiple times per week, could push forward a project, an initiative, or even just to prove to yourself that you can do hard things. It doesn't have to look like mine. It can be your passion. So as we wrap up today, I challenge you to consider how this deep work and craftsmanship might fit into your current season as a physician or medical student. What are your high-level priorities professionally in this season? It will look different in med school, in training, after training. How are you adding value to yourself and your learning, your project, your vision, and how does that ultimately help you provide value to others and help them? Where do you need to apply some of these principles around deep work to help move your vision forward? Are there some things you can graciously move off your plate? Choose one action and commit to doing it this week. Take the next step in your wellness professionally today. Your future self will thank you. Again, thanks to TextExpander for their support of this show, and visit the link in the show notes for 20% off your first year, allowing you to reduce keystrokes and get things done more efficiently on all your devices. Thank you so much for joining me here today on this, the second episode of the MedEdWell Podcast. If you found this helpful, please share it with another physician or student today, subscribe to the podcast, and leave a review. Please also follow MedEdWell over on Instagram and engage with the content there as well. Tune in to the next episode to hear more insights from Cal Newport's deep work as I examine how fixed schedule productivity, batching, and Parkinson's law apply to getting your work done more efficiently. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.